Let's talk about the HSG, also known as the Hysterosalpingogram. When trying to conceive, the HSG is a common test a doctor will order. During this test, what they do is they inject dye through the cervix into the uterus, and they're watching this dye as it flows through the uterus, and it also goes through the fallopian tubes. It should spill into the pelvic cavity. As this dye is flowing through the uterus and the fallopian tubes, the X-ray machine is taking pictures. And this will help us see if there's any blockages in the fallopian tubes or if there's any abnormality in the uterus. The test usually takes anywhere from 15 to 20 minutes. It can be uncomfortable. I would ask the doctor if there's anything you can take beforehand to make it more comfortable. And it's usually done in between, right before ovulation, but after you kind of ending your cycle. So maybe on cycle days 6 through 10. So if your doctor recommends this exam, don't panic. This is a very normal workup, something we do regularly just to assess the patency of your fallopian tubes and to assess your uterus. So why are we looking at the fallopian tubes, right? The fallopian tubes are crucial for getting pregnant because the egg is released from the ovary and it flows through the fallopian tube, and that is where it meets the sperm, because the sperm will swim through the uterus and it'll swim up the fallopian tubes to try to meet the egg. So if the fallopian tubes are blocked, there's no chance of getting pregnant. And this is why we need to make sure that they are open. So if you're doing an IUI or you're doing timed intercourse, this is especially important for those types of treatment options.